My name is Monique, and today I come here to share with you my personal experience as a parent and the availability of mental health resources within Colorado Springs. I have a child, I actually have 3 children, 2 of which have mental illnesses. The one I want to talk about tonight is my son. At the age of 10, he had suicidal ideation and had his first and only, thank goodness, attempt. He tried to jump off a balcony at the apartment house that we lived in while I was at work. What brought him there? Good question, and how come I didn't see it? It was an excessive amount of bullying by his peers and some of his educators at his school. The bullying led him to feeling depressed, anxious, unworthy, and in some moments pretty hopeless. But he's a master of disguises and really tried hard to hide those from us because he had an older sibling who had already lived through these things. I was called at work and I immediately took him to Children's Hospital. He was then transferred to the Anschutz campus in Denver, where he would stay there for 7 days, and we would drive for 7 days after work for visiting hours. My child was discharged with no plan, no follow-up appointments, no resources, no psychiatry, no emotional behavioral health support, nothing. He was just discharged. This would take us down a path of roadblocks to find access to pediatric mental health care within Colorado Springs. Even with good insurance, it was impossible to find someone who was taking new clients, new patients, anywhere. We stumbled upon 2 of them. We tried them both, and they either didn't have time to listen or just wanted to prescribe medications. Being a mom who already has experience in this, I knew that this was not the only option, and we needed to do more. It made me start thinking about parents who don't have other options, parents who don't know. Where are they? I know how overwhelmed I felt the first time. Now I'm living it again in a new place, a new state. It's frightening. It's overwhelming. Tonight I want to ask you, why are we failing our children? Why do we approach all of our other healthcare ideas, our primary care, our oncology care? Everything is about preventative care, but mental health is not. Mental health is about crisis care. We wait till a child is at their outermost limits. They are too much for some facilities to take and not bad enough for others. Where's the middle ground? There isn't one. And why are we failing? Why can't we do more? We need to do better. Too many children are suffering from depression, anxiety, suicidal ideation, and suicide attempts. Some manage to complete the task. My 2 older children have lost friends to suicide. My son, now 14, recently lost one, and last year lost another friend to suicide. In 2019, the CDC data showed that 34.1% increase in suicide in Colorado. Furthermore, in 2019, Colorado Public Radio put on an article that states that teen suicide in Colorado rose from 12.9 to 20.4 deaths per 100,000 adolescents ages 15 to 19. It's appalling, and we need to do more. That put Colorado rated 6th for the worst in suicidal ideation and suicide in the nation. 6th place. I have ideas. We can do outreach to our youth when they're young. We can start in kindergarten, start teaching value-based curriculum that's age appropriate. We can start in kindergarten. We can create advisory groups, which is where we're at kind of now, creating programs that are age appropriate in all grade levels, training our educators to be aware of the signs and symptoms, offering resiliency programs at the high school level, offer children an idea, a way out, coping mechanisms to help them on their daily activities when they're being triggered by emotional, what is the word I'm looking for? Overwhelmment. Resiliency is key. It's more than just vulnerability. It's more than transparency. It's about teaching our children the skills they need to live their daily life in a time when social media is constantly attacking them. They have no respite. In high school, they offer programs like my middle daughter, she was in the Chief of Police Youth Advisory Group in Council. She, in her senior year, put together a program for her high school about suicidal ideation and awareness. we can educate our children. We can do better by them, but we have to want to do it. Mental health is not known for making a lot of money, but is it about the money? Or is it about our mental well-being and our future? Our children are our future. They're the ones we're going to have to take care of. And if we don't train and teach them now, later on it's going to be so much harder.